Dr. Arnold Bugah Bunyoli, consultant obstetrician gynecologist here at Mama Lucy Kibaki Hospital, Nairobi, Kenya. I undertook the course of postgraduate diploma in sexual and reproductive medicine. I came to know about this course through the FASC, which is the Fertility and Andrology Society of Kenya, where I was given this opportunity and underwent the course for a period of 12 months. The number of fertility specialists in the country is still low. More training for obstetrician gynecologists to undertake this infertility subspecialty is needed. Hence the need of the importance of this training that I undertook, that can be a way towards proper subspecialty in infertility. Currently in Kenya, we do not have training in fertility. So most of the subspecialties are done outside the country. The treatment options of infertility are there, mostly in the private sector, and this is also carries the issue of cost. IVF is the IVF centers in Kenya, and the costs are very high for the common person to afford. So this leaves out majority of the Kenyans who need these services, because very few are going to have these services availed for them. So the training I received under Merck Foundation for the postgraduate diploma in sexual and reproductive medicine was offered online. The course was quite interactive. We had sessions with our tutors who took us through every module and enabled us to discuss with each other. And also at the end of the module, we had the end of module exams just to see how our competency has been thus far. There are no similar programs in Kenya that is offered in quite a manner, so it was quite an interesting and a good approach to learning, especially adult learning. Postgraduate diploma in sexual and reproductive medicine, which is mainly the infertility and subfertility area, is going to offer a lot to my patients, because I provide my services in a low resource setting area, in a public setting. These patients are going to have services that were not being availed prior to my training, or if they were availed, they were not in an evidence-based manner. So this training has enabled me to be able to provide these services in a proper manner. In terms of career, I would like to pursue a fellowship in reproductive endocrinology and infertility to further my training in fertility, and training in IVF and embryology. In all essence, just to be able to be infertility specialist in the country, and this is going to benefit the patients I serve later on. In the country, there's a lot of stigma that is attached to infertility, and a lot of couples do not seek help in the hospitals when having such difficulty. This in turn leads to a lot of women undergoing domestic violence, and we also see it in our infertility clinics where men rarely do come for evaluation. So there's still a lot of stigma surrounding infertility, and this also brings challenges in terms of its management. My expectations in the training of postgraduate diploma in sexual and reproductive medicine was to enhance my knowledge in infertility, and through the training these expectations were matched, because we were taken through all the subtopics of male infertility, female infertility, and also the basis of in vitro fertilization. As a consultant obstetrician gynecologist, I'm a mentor to the junior doctors. So by mentoring the junior doctors in terms of how to approach to infertility patients, this is going to improve the way they manage the patients that they handle. My advice to the aspiring doctors who would like to undertake the postgraduate diploma in sexual and reproductive medicine offered by Merck Foundation is to tell them this is an excellent it's an excellent course. It gives you the pathway to becoming infertility subspecialty. It gives you the knowledge and ways of managing infertility patients in an evidence-based manner. It gives you the know-how on when to and how to refer infertility patients in case of being unable to continue the management. I would like to thank the Merck Foundation and University of South Wales for offering me this course of postgraduate diploma in sexual and reproductive medicine. It was an excellent course, and I would like to encourage other doctors and other healthcare workers who can be able to pursue this course to do so, because it enhances our knowledge and the capacities to handle infertility patients.